your time, plan your stops and arrive safely. That's the message from rural doctors this Christmas. After travel has been restricted for so long, some rural residents will be travelling to see family and friends for the first time in months, adding to the Christmas traffic. Joining us live now is Rural Doctors Association of Australia CEO Peta Rutherford. Peta, thanks for joining us. Many of us haven't had a long drive in a while due to lockdown. What do we need to do before getting in the car?
Well, I think it is about lots of good planning and, making sure that plenty of time is allowed, there's plenty of rest breaks, but also, we know that with the testing and, travelling interstate, that some people need to have that test that may not have came through as quickly as what some people were expecting and now may feel a little bit rushed. But please don't speed and just make sure you allow plenty of time so that you actually arrive at your destination safely.
That's very good advice. What are some of the mistakes that people make before getting behind the wheel?
Well, I think tiredness is the key thing. I think, a lot of people will be trying to finish things up, before they head off on their trip. And as I said, if they've had to get a COVID test before they leave, they may not now have the time that they were anticipating to travel and make their journey. So I think it's really important that if people are feeling fatigued, that they do stop, they do have a rest, and also ensure that, the kids are well entertained in the back and that so the driver isn't distracted by anything, that may disturb their concentration and attention to what's going on around them.
Also, people will be travelling to areas where they may not be going often. What are some of the big differences between driving in regional and rural areas compared to in the cities?
Well, unfortunately, speed is often one of the big things. And I think, don't anticipate that just because you're on a rural road that it's not a busy road or that it's not unexpected. I mean, we do have, a lot of issues with wildlife on the roads in rural and remote Australia. Sometimes it can feel like a little bit of a safari. That's great for entertainment, but you really have to be aware and watch for the kangaroos, the emus and various other things that can come out, from the side of the road unexpectedly. So it really is about being cautious, being aware and don't speed.
Peta, while I have you, the booster program is being accelerated. It's going to be shortened to a 3-month gap by the end of January. Do you welcome this?
Look, we certainly think it's important that the government follows the clinical advice, and the advice is coming from ATAGI and trying to ensure the safety and well-being of our communities. And we certainly encourage people to make their appointments as soon as they become eligible. We would also ask, though, particularly in our rural and remote communities, that the GPs are, really busy. They're already doing a lot of vaccinations. They're doing the testing. We expect COVID cases to rise in these communities. So they just need to be a little bit patient, that there's only so many hours in the day and there's going to be a lot of people that are due for their booster shot. Which is sort of fast-tracked from what was happening with the original first 2 jabs. So there is only so many hours in the day, but make the appointment and you will get an appointment as soon as it is physically able to be delivered.
Also, New South Wales and Victoria have brought back mask mandates and various restrictions. Do you think that was a good idea?
Oh, overdue. And we certainly have been calling on, for mandatory mask wearing for a number of weeks. We felt that this has been a key thing, that it was probably relaxed too early. So, seeing case numbers in New South Wales of 5,000 plus for the last couple of days is worrying. And while, the evidence is showing that people may not get as seriously unwell with the new variant, we know that it's basically much more transmissible, so that there will be more cases. And therefore we will see people go into hospital and need at least GP community care. So it's a challenge, and we certainly welcome the mask mandate and the return of the QR checking codes.
We have to leave it there. Peta Rutherford, thank you so much.